All right, what's up, everyone? Dr. Dan, this is my lovely wife. Say hello.
Hi.
She's dealing with a little bit of a sore throat, and so we're going to go through chiro appointment. Right side sore throat. We also found that her right neck, right upper trap, all of her muscles in the right side of her shoulder are really congested and inflamed right now. So there's two ways that sickness occurs. We have the viscerosomatic and the somatovisceral kind of connection, right? So lymph node to spine and muscle and nerve, and then spine, muscle, and nerve to lymph node, right? So if we get an infection like a viral infection or a bacterial infection that clogs up the lymphatic system, it can very easily and very commonly cause diffuse neck pain, whether it's on the side of the neck, up under the mandible, or even back into the trap muscle, right? So you've seen on some previous videos how we always do neck work and shoulder work with all of our people that are in here. So just kind of palpating my wife's mid-back on the right side. She's got a lot of just general inflammation from like her first, second, third, fourth thoracic vertebrae, and even up into the right side of her neck. So we're going to start off with a little myofascial release. We're going to drain some of the fluid out of the lymph nodes, right? So if you've ever been sick and you feel like how backed up everything gets, it's really beneficial to help with some myofascial therapy to drain the lymph nodes out, to ultimately get that congestion down into your digestive tract, processed by the liver, and down into the small, large intestines, and ultimately out of the body, right? As opposed to just kind of sitting there and complaining about being sick for days or weeks on end, not taking care of the muscles in your neck. So if you are sick and you're all cooped up, the bacteria and the viral infection, it's going to drain slower if you have worse posture and neck muscle tension, all right? So we're going to go through some myofascial release on her neck and shoulders. And we're just going to do a quick scan and feel that right down here in the upper trap area, this is where a large group of lymph nodes resides at, right? Your lymph nodes, they're kind of like your sewer system for your body. They clean out all the toxins that we come into contact with. So whether it's a bacteria, a viral infection, environmental pollutants, so sometimes you can breathe chemicals in through the air if you've ever smelled like gasoline or smog or emissions from a car, right? All the things that come into contact into your body, like whether they get into your body through your nose, your mouth, your skin, through your ears, right? There's a lot of open pathways that chemicals can get into our body. They have to be processed by the lymphatic system, and the lymphatic system kind of pulls all the junk out of the bloodstream. And so what we're going to do here right now, we're doing a little inferior to superior movement, and then we're going to start to drain this stuff back down. And we're just doing very light pressure just to help desensitize the skin a little bit. I'm just kind of scanning the area and just feeling where she's restricted at, and definitely she feels the right like C2-3 vertebrae right here is all jammed up, and so that's what we're going to adjust ultimately. Lean your head to the right and to the left, and right and left and right and left. And what I'm doing, I'm just doing a little pincher grip on her neck, kind of localized right over the second, third, fourth cervical vertebrae, and a little pin and stretch therapy to help reduce some of the muscle tension, help stretch this area out a little bit. And she feels it as tenderness. I feel it as thick, balled up musculature, inflamed joint that doesn't belong. Right and left. And you can just kind of see this line of muscles right here, the scalene muscles, the upper trap portion. And this is just where she's all congested at, and that's what we're going to flush out. Right, left, right, left, and right. So what this is going to help with is, again, just kind of a good general lymphatic drainage exercise. I'll show you at the end of this video how to do this on yourself if you don't have a chiropractor husband or somebody in your group of friends or anybody, or you go to see a professional, which is what you should always do, right? And lean right and left, right and left, hold right there. We're gonna just pull this hair out of here, and we're gonna work around right and left, right, left, right, left, right, and left. Good. Okay, tilt your head back for me. Now, up under the jaw, you have your submandibular lymph nodes, right? And these are the guys back here right by the tonsils. They get really congested. They pull a lot of the bacteria, a lot of the viral infections out of your mouth that you might breathe in or chew in or get on your food or anything like that. Little tidbit, you know, what is such a common procedure in the medical world is tonsil and adenoid removal, right? So kids and parents also, if you have chronic strep infections, chronic throat infections, chronic tonsillitis, doctors are very quick after, you know, if the antibiotics don't work, you know, next step is if your kid's having recurrent ear infections, they'll put tubes in your ears. And ultimately, if the doctors don't treat the strep continues to infect, and the next step is tonsil and adenoid removal, right? So you don't want to get your tonsils and adenoids out. There's many other options to undergo before the doctor tells you to do that. So you should look into some alternative therapies, whether it's chiropractic care, massage therapy, acupuncture, see a good naturopath. If the antibiotics are not working, generally they don't, all right? The strep is going to come back. And you can feel right in there. So we're just doing, again, just a little myofascial release. Right up under her mandible. And now we're going to go right down the front of the neck right here where she's got some of her prevertebral lymph nodes at. And I'm just doing light pressure just right over the lymphatic system. So if this looks on the video like I'm pressing super hard on her neck, it doesn't really hurt, right? It doesn't really hurt at all. But again, just flushing the lymphatic system downward. All right. All right. So now we drained the mandible. We drained the side of the neck. We're going to do a little work in her trap right here. And then we're going to get her adjusted and get her to feel a little better. Okay, look up straight, down, up, down, up, down. Sometimes during these treatments, hair gets a little messy, up, down, up. But it's always better to feel better, and you can clean yourself up after. Down, up, 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 down. Awesome. All right. And now just a general upper trap treatment to both sides. Look up straight, down straight, 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 up and down. Good. We're going to move this up and down, up and down. And so what this little pin and stretch, little muscle work helps to do, look up, helps us to promote blood flow, basically improve circulation, promote lymphatic drainage. Look down, helps us to reduce some of the stress that she experienced throughout the day driving around for her job all day long. Her neck gets tight, her shoulders get tight. She does a number of car exercises, which you guys can find in other videos. Look up. She's been working her lats so she can take a lot of the tension out of her neck, and down, and up, and down, and up, and down. Good. All right. Good job. All right, cool. So let's go face down on the table. All right. So big things that we found with our kind of like pre-scan was her second, third cervical vertebrae on the right side is all jammed up. Lots of inflammation over there. The C2-3 nerve that leaves the spine and kind of comes around, it makes some of the facial muscles work, some of the throat muscles work. It's responsible for skin sensation on the head and the face, right? So again, if you're sick, you can have lymphatic swelling and the obvious symptoms of like, you know, cold, sinusy, throat congestion, but you can also have neck pain, shoulder pain, mid-back pain, kind of just that general discomfort from the inflammation. All right, so deep breath in for me. Exhale out, easy out, good. Easy out, good. Breath in. One more, exhale out, whole way out, whole way out. Good. All right. Okay, we're going to face over to the right side up, this way over here to the mirror. So, okay, we're gonna go hands here. Take a deep inhale, exhale out, whole way out. Awesome. Other side for me. Here. Good. Cross like that. Take a deep inhale, exhale out. Good. Flatten your back for me. All right. So lots of movement in the low back, a little bit of movement up in that thoracic spine. We're gonna get her neck to adjust. She's a little congested on this right side. So again, you guys will see what we gotta do here. On the left, and one big one on the right. Shoulder down for me. Good, one more on the left now. Relax that left side. There we go. All right, cool, sit up for me. Spin to the left. All right, good, we got her adjusted. Neck, mid-back, low back. Got a little movement out of that C2 on the right side. And already muscle tone in the shoulders has decreased, which is awesome because she was all jammed up. Still a little bit on the right side. What we're gonna do today to finish this up is administer a little deep tissue laser therapy using our light force laser. And we're gonna do that right under her mandible, in her throat, and on the back side of her neck to help stimulate further mitochondrial support, to help reduce the inflammation that's present, as well as support general immune function. The deep tissue laser is really awesome also to help heal muscles, bones, ligaments, anything that's damaged. It basically helps to regenerate faster. So you guys will see what that looks like here. All right, guys, so we're gonna finish up the treatment with a little light force deep tissue laser therapy, right? So what this is a 25 watt laser. It's got a little red light and then some infrared light. So it's both beneficial for cellular regeneration, ATP production within the mitochondria. Basically, if you have any kind of damage, muscle strain, bone, damage, stress fracture, connective tissue inflammation, you're just generally sore from exercise, deep tissue laser therapy is a great option to help reduce inflammation and promote regeneration of healthy tissue. Now we're going to use this for her neck, up under her mandible, around the SCM area and all those little lymph nodes that we talked about, to get some circulation flowing up into all that congestion. That's going to help to bring some white blood cells up into the area and hopefully help her fight this infection off a little more efficiently, right? So we're going to strap in and get going. All right, so you're going to tilt your head up. And I'm going to pull this over a little bit, right? You're going to lean your head to the left and tilt your head up. And you just tell me if this gets too warm at all, okay? So you guys on camera see the red light, and there are two different wavelengths of light coming out of this laser right now. One is visible spectrum light, and the other one is infrared light, right? So what you can't see or feel on camera is how hot this laser is. And light therapy is an awesome, cutting edge, almost futuristic approach to medicine and healthcare There are many different levels or classes of laser. This is a class 4 medical laser, so this is one of the more powerful ones. It's actually a hot laser. There are also cold lasers, which you may have heard of. Cold lasers don't produce any heat. You really can't feel the laser. It's a different wavelength, and it has different effects. This deep tissue heat laser does get pretty warm, so my wife's going to tell me if anything gets too spicy, but tilt your head up. But she's going to feel the soothing effects of the laser, which again is going to promote circulation and ultimately help to improve her immune function so that she can fight off this little throat tickle that she has, this little infection or whatever it is. Tilt head way up, up, up. Press jaw forward. Yep, like that. All right, I'm going to pull this over a little bit, okay. Lean head to left. All right, now we're going to look down for me. I'm going to pull this down a little bit, okay? Not too hot yet, right?
No.
So general deep tissue laser treatments are anywhere from like a couple minutes, 3 minutes, if it's a small area like a finger or wrist or something. And we can use the laser for anywhere from like 8 to 10 minutes on the larger body parts. So like neck, shoulder, low back, hip. Common conditions that we will use the laser on, again, neck pain, back pain, muscle strains, joint sprains. If you roll your ankle, we'll get kids back to playing in a week and a half with some therapy, some soft tissue work, and some deep tissue laser therapy. It's awesome. So if you've been dealing with any kind of chronic injury, or even just if you just hurt yourself with an acute injury, looking into a provider that has access or that has a deep tissue laser will help you to achieve faster results and feel better quicker. Get back to your sport, your playtime, get back to life, right? Nobody has time to be sick and injured and not feel so hot, right? We want to get back to the fun stuff in life, the day-to-day, all the good activities. In my job, working to make people healthy and help people to move better, which is an awesome job. Lean your head to the left for me. And then where we're going again with this is just kind of like the posterior or the back side of the body or back side of the neck, up under the ear, right where the mastoid air cells are at. The mastoid air cells, those are kind of like little cavities in your skull, and that's where a lot of fluid, and if you ever had an ear infection or a sinus infection, sometimes you can get a lot of like pressure in your ear. And so a lot of bacteria and fluid will accumulate around the eustachian tube, in the lymphatic nodules, and down even into the muscles of the body, right? So 3 things we did today: some muscle work, an adjustment to our neck or mid-back or lower back, and now we're finishing up with some deep tissue laser therapy. Look straight down for me. We're going to do 30 more seconds. Lean your head to the left again. And feeling the warmth, right?
Mm-hmm.
Definitely. This is So we just upgraded our laser. It used to be a 15 watt laser. Now we upgraded to 25 watt. 25 watts means more power, quicker treatment times, more energy delivered to the tissues. All right, that's good. Cool. All right, glasses off. Sit up tall. Little stretch for her to work on, like you see all of our people that leave here with. A little bit of thoracic extension throughout the day to reduce tension up in the neck, activate her lats, and get us out of that. Sometimes we catch ourselves up in that shoulder hiked position, which is not good for the lymphatic system. All right, that's it. Happy to see you guys on here. Stay tuned for future videos. We're gonna strap in and get going.